Hello, my friends. Brenda L. Balding here. So glad that you're with us today for Love's Inner Voice. I have a wonderful guest, Dr. Charles Rothschild. We'll be meeting him a little bit later, but right now, let's do our heart coherence breathing. Breathing in light and love to the count of 5 through your heart into your lungs. And as you breathe out, let go of anything that you're ready to get rid of right now into that love and light. Let's do that 3 or 4 times, just breathing into the count of 5, breathing out to the count of 5. For me, it just assists me to become present in the moment, because now is all we have. So let's make the best of it. Wonderful, wonderful. So I mentioned that I have Dr. Carl Rothschild here with me today, and he is a longtime chiropractor for many, many years, and he is an advocate of the red light therapy, and he's going to give us the truth about red light therapy and how it can assist us on multiple levels of healing. He is passionate about healing and about assisting patients, people, us humans, to heal and to transform with red light therapy. His journey in the field of healthcare is a story of dedication, innovation, and heartfelt commitment. He has a solid foundation and a doctorate from Southern California. He's been serving the community in Los Angeles with his compassionate approach to chiropractic care. He is also a founded Lipo Melt Technologies, Trifecta Light, a company specializing in professional grade red light therapy devices, and he can share more about that later. He's also an author, and I encourage you to take a look at his Illuminated Healing book that he wrote in 2023. Please welcome Dr. Carl Rothschild to the show.
Well, I certainly appreciate it. Hi, thank you. I always love the opportunity to spread the word and educate people as best I can. I want you to know that it started in 1972. I was a junior at Stony Brook University out in New York, which is a pretty good school. And I was fanatical about biology and the human body, but I didn't know where I was going with that, to be honest with you. And I was introduced to chiropractic, which back in 72, and for many years after that, it was pretty much frowned upon in New York, but it piqued my interest. And I started calling chiropractors all over the country, and everyone I spoke to loved what they were doing. And so now, what did I want? I wanted to help as many people as I possibly could. I did not focus on money as being my direction. I don't mind making money, but if that was all I was doing, I wouldn't be happy with that. So I became a chiropractor, and I really loved it. 1978, I started as a chiropractor in Los Angeles. I moved from New York to California and opened up my practice outside of Los Angeles, and I had fun. It was very special back then because there weren't that many chiropractors. So Most people would say, "Well, what is that?" And I
Oh,
love introducing it to people. And then about 20 years into my practice, I was introduced to red light therapy. So, I mean, it was an orthopedic surgeon out of USC. And forgive me, I need to put my phone on mute. I forgot to do that. So, his name was Chadwick, and it is Chadwick Smith, a relatively famous orthopedic surgeon out of USC out here in California. And he hands me, I knew him before he was involved with lights, and he hands me what looks like a flashlight. And it was about that big, like a flashlight. And he said, I want you to shine it on all your patients and help me make a difference in this world. And of course, I thought he was nuts. I mean,
yeah.
at that time I was in practice for 20 years, being a wise guy from New York, thinking I knew everything. And now you're going to tell me it's as simple as just shining a light on people and it's going to help. But I agreed to introduce it to my practice. And within a month, we started seeing some pretty interesting changes. Now, I'll tell you that equipment was thousands of times weaker than what we currently have. But even yet and still, we still had nice results. So this lady, I would go to my patient and say, well, what do you have other than what I've already been treating you for? And this lady says, well, I have gum disease. I helped the gum disease. And this guy had kidney problems. We helped his kidney problems. We had a guy come in with a ripped Achilles tendon, and we sent him to the orthopedic surgeon for surgery, but it was like a week before he was going to get the surgery. And I told him, just come in every day and we'll treat it with the light. And let's see if it doesn't help make the surgery easier. And when he went for the surgical review, he didn't need the surgery. And that was powerful. Then about 14, 15 something years ago, it was discovered that there's an element of light that actually can help with fat loss. And they didn't understand how that possibly could work, but it consistently was proven that it could assist people. And so when I knew that and heard that and saw that, I decided I was going to become more heavily involved, and I started doing my own manufacturing. I wanted the best equipment. I knew what it was needed. I knew the lights. I knew the equipment that we needed, and I knew the manufacturing company that was the premium company in the United States. And I hired them to help me build equipment back then. And back then, 14, 15 years ago, it was smaller items like pads or lasers or panels or things like that. But what was uniquely different back then was that it did not cover the whole body at the same time. This is important to know because about 5 years ago, when COVID first hit, our practitioners wanted less physical contact between themselves and the patient. And so what we did was we created a bed. In fact, when people ask us, well, how much does the bed cost? We go, well, first of all, you don't need staff. The patient gets in and out of the bed themselves. I have a bed here in my home. I get in and out myself as anyone could. And but we've started delivering about 5 something years ago, the first series of beds, just thinking it would be a nice substitute of what we had up to that point. And lo and behold, there were amazing feedback we got. So one of the ones that I often use in my talks, especially when I go live to a conference or something, besides asking everybody to raise their hand that knows anything about red light therapy, if I would have asked that question years ago, almost nobody would raise their hand. Now a lot more people are raising their hand. But besides that, I would tell everybody, listen, pretend if you're a health practitioner, good, and if you're not, pretend you are. And I'm going to bring a patient to you, and I want you to tell me what would you do for that person. This patient is having a heart attack. 12, 13 years ago, he was having heart attacks averaging once or twice a month. And so they implanted a defibrillator in his chest. I mean, so obviously years before that, he was having severe congestive heart failure. It led to frequent heart attacks. And every time he died, that defibrillator would zap him back to life. By the time we met him, he was having as often as twice a week. And everything, and he was a mess. Everything was suffering. If you want to kill off a part of your body, restrict blood flow. Well, he did that by having his heart problems, his whole body was suffering. Every organ, every gland,
Right.
energy,
Right.
everything was
Yeah.
gone.
Mm-hmm.
So I would ask the practitioners, well, what would you do with somebody when they called you up for that? And I could tell you the only thing the medical world had was this defibrillator that eventually, now it's twice a week. Eventually, they were all watching him eventually die. I mean, there was nothing
Right.
to help him. And so my practitioner one of our practitioners calls up and says, well, what should I do with this guy? I don't want him having a heart attack in my office. I said, let's just treat him for 5 minutes. Normally a dose is 12. Just treat him for 5 minutes and stay in the room the whole time. And that patient went home that night. That was about 2 years ago. He's had more treatment, but he's never had a heart attack since. And everything has come back to life. And when I mean that, I mean his every organ, every gland, his energy, as he described it, is now through the roof. And, I mean, when you have people like that are so excited about what's happened to them, that's how you build a practice. You build it not from your satisfied patients, you build it from your excited people. And I've never seen more excited people than I have over these more recent years since we've been developing the bed. And what we learned is that when you bathe the whole body at the same time, not different parts, the elbow, the shoulder, I'm talking head to toe, left and right, front and back, inside and out, affecting as many cells as possible. That's when you're seeing these miracles. And I don't know what other word to use, but miracles. It is miraculous what we're seeing. And I'm loving it. I've never heard the phrase, thank you for giving me my life back, as often as we're hearing it now. And what did I do in 1972? What did I want in 1972? I wanted that. I wanted to help as many people as I possibly could, or be the assistant, indirectly helping as many people as we could. And we've never seen so many people be this content, this happy, this excited. And now it's gotten to the point where you would be hard pressed to find any condition, including Parkinson's, dementia, autoimmune disease, multiple sclerosis. We had a patient that had Leber's hereditary optic neuropathy. Nothing anyone could do for him other than watch him go blind. So he had lost probably half of his eyesight by the time we met him, and he tried the light. And what it did was it halted the progression. It got rid of some of all of his other symptoms, including the kinds of headaches, including migraines, the insomnia, the energy issues. Those were all improved dramatically. But the eyesight he already lost, I doubt if we're going to gain that back. It's like a cavity that's eaten away at the retina. It's essentially multiple sclerosis of the retina. So even with multiple sclerosis, the same kind of results we're seeing is that you halt the progression. You don't reverse what's already damage done. So we suggest if anybody has that type of issue, they get treated earlier rather than later. But almost every other thing that you can think of, we had a lady that had a stroke. Within 8 visits, no more signs. She was better than before she ever had the stroke. So let me then say that I'm not really making claims. In my mind, I'm reporting the news. I'm telling you what I know. And I'm not guaranteeing that whatever ailment you have, we're going to get rid of. But it would be smart for each of you to try 6 visits, only 6 visits. That's 12 minutes a dose, 3 times a week for 2 weeks, 6 visits. And if you don't see any change at all, I would be very surprised. Now, I'd only recommend you do this if you have a problem. If you feel great, I don't know if you're going to see a difference, to be honest with you. But if the worse off you are, the more dramatic typically the change is. So I'm talking about advanced Parkinson's, where it was impossible practically to get the person to even lie down because they're so rigid like a stone. And getting out of the bed was way easier just after 1 visit. And after a few weeks of treatment, that lady's quality of life went sky high, relatively speaking. I mean, she's still 85 years old. She's not going to go run a marathon, but her quality of life, she had severe dementia and she wasn't lucid. And now she is. Now she can communicate wonderfully with people. And so they don't have to put her in a home. And that to me is extremely thrilling. I don't know what you guys are thinking, but again, if you think of any condition out there and wonder if it can help, the worst that'll happen, this is important for you to know, that in the 50 years that they've studied this technology, there's never been a recorded side effect. You couldn't hurt somebody with this stuff if you tried. And then there's a world of contraindications. So contraindications mean who can or cannot get in this bed. And technically, there really aren't any contraindications. So you can get in the bed with metal, with electronics, including pacemaker and defibrillator. You can get in there with anything like that. There were just two, not real, but we call legal contraindications. And one of them, and this is a common contraindication for a lot of therapies, and that's pregnant women. We know that the lights would be helpful to the mother and the fetus, but if that baby is destined to come out anything other than perfect, they're going to want to blame somebody for that. And I tell my people, let's not be in that neighborhood. Wait until after she delivers and then get her in the bed as soon as possible, especially after C-section. The recovery is incredible, much faster and much more thorough. And that's true of any surgery. Anybody that has surgery, because I'm not against drugs and surgery. I'm against the way it's used often in this country, where it's the first thing that people look at instead of, well, let's try the alternative first before we rip a part of your body out. Chiropractors don't believe, unless there's no other option, of putting anything in the body that does not belong there or yanking anything out that does belong there. So getting back to the fat loss that we learned about 14 years ago, I want to just tell you about the mechanism, because they didn't understand it. They thought, well, maybe it melted the fat. And that's not what happens. And a lot of people think that it's about destroying fat cells. And that's not what happens. So it's not like freezing the fat, boiling the fat, lasering the fat. It's not like radio frequency or ultrasonic cavitation, which are all about destroying essential tissue, which as a chiropractor, I would never agree with that. Destroying tissue is nuts. The fat cells just have a bad name, but they actually have important roles in the body, including stem cell production, including hormone production, and of course, yes, absorbing and storing certain elements, including fat and other toxins in the body. So when we start using red light, which is what releases the fat from the fat cells, some of the fat from the fat cells, it also is accompanied with some toxins that we're releasing. So some people in the beginning, first week or so, they might be a little more lethargic, but by the end of the second week, or maybe a little bit more, the energy will be through the roof, and they'll start seeing the fat reduction. And it's a whole nother, mechanism. I'm not telling people can go home and pig out and get drunk every night and not and assume they're going to have great results. It's about a smart diet with smart exercise and adding red light therapy to it. It's as simple as that. Now, in a little while, I'm going to go over the mechanism, how everything else happens. I call it the healing aspect, or the treating aspect. And that's where the miracles are. I didn't start in practice to try to trim everybody to lose fat, but the truth of the matter is there's probably nothing more popular than that. So from a business point of view, you want to incorporate that in your practice. It's absolutely non-invasive. It's safe as can be. Again, you're not destroying anything. A lot of other things talk about being non-invasive, but the truth of the matter is they're killing cells. They just do it externally, which that's not what we're interested in doing. So that's about fat loss. Anyhow, so there we are producing the bed, and the results are spectacular. We had the guy, Steve, who had contracted Lyme disease when he was 12, and it ruined his life. So he couldn't have a career or a serious education, because there were times when he couldn't get out of bed. His energy was shot sometimes. Now, he had some good days, he had some bad days, more bad than good as he was getting older. We don't meet him until he's in his 50s. So he's 40 years into having Lyme disease. And he gets in the bed and he gets out and he sees nothing different. And when I'm interviewing him, he says that, and I'm going, uh-oh, maybe I'm interviewing the wrong person, because I haven't heard that before. But then he starts telling me about, and what got me the goosebumps on me was the changes that happened hours later that he noticed, and then ever since, how improved he is. So I'm going to be sending you some videos, testimonials, and the show notes and stuff like that, and you're more than welcome to share that with your audience. And one of the ones I want you to watch is Arnett, and that's the one with the heart attacks. I want you to watch the one with Steve. That's the one with Lyme disease. You're welcome to watch the one with Jerisha, which is stroke. But also there's this lady, her name is Jessica. And I'd never heard of this before. When I called her, she said she had some improvement and would like to testify, go on and do a recording with her of her testimonial. And after it was said and done, all done, I counted all the conditions that she had. It came to 16 serious conditions that required drugs, injections, doctor visits. She spent most of every month on her health, and she was stuck. I mean, she had one of the things she had was uveitis. Now, that's a swelling in her eye. Gone untreated, she would go blind. So the treatment for that was an injection in her eye once a month.
Oof.
And when I asked her, well, what was that like? You got to watch that video about how she describes that. And after just a relatively short period of time, she goes, yeah. And within a short time, my pressure was down to normal. I said, well, do you notice other differences? And, so her eyesight's better, her pains are better. Her 3 forms of psoriasis, including psoriatic arthritis, plaque psoriasis, and guttate psoriasis, were horrible. So she had rashes and bleeding around her ears or across her forehead, down both arms and both legs. And it was embarrassing, but also it was painful, and it required more drugs. And that all 2 visits, and that was mostly gone. Now, it often takes much more, more than 2 visits, but I'm saying after 6 visits, you're going to see a difference. If you have a problem, I can't swear to this, but I'm pretty sure you're going to see a difference if you have an issue. So to that end, sort of half jokingly, I say, you're no longer allowed to complain. What I want you to do is to get in the bed. Now, I'm not in practice, so I'm not inviting you to my office. This is not financially a benefit to me. It's a great benefit potentially for you. I want you to get in a bed and try it 6 times. Now, we have offices all over the country. So if you go to our website, which is trifectalight.com, and the word tri meaning the triple effect of face, fat, and healing. But it's much more than just face. It's the skin from head to toe. But our first device didn't have the bed. So, that was face, fat, and healing is where the trifecta word came from. And winning the trifecta at the horse track race, horse racing was how it was, you just won. It's like winning the trifecta. So if you go to trifectalight.com, trifectalight.com, and go to the Contact Us page, on the left side of that page is an opportunity for you to find an office closest to you and do that. And we're not going to hunt you down. We're not going to do anything. We're just going to send you some locations that are closest to you, and I recommend that you go. Tell them you want the Rothschild special when you go, and get those 6 visits. And after 6 visits, I'd love for you to then go back to that Contact Us page, and towards the bottom of that, you can just write me an email, or actually the office will send it to me, and just tell me how those 6, after 6 visits, what happened to you. And I've yet to see really very few things that we have not seen great success with. And those are, like, if someone lost a finger, I'm telling you, we're not growing your finger back. And if someone has waited too long, way down the road, it's possible we will not be able to reverse that. But if we can get you, but we've seen horrific problems that have been reversed. Like I said, multiple sclerosis, any neurological issue, like the thing with neuropathies, unbelievably, that there are people that are so bad off that they can't sleep with a blanket over their legs because the pressure of the blanket they can't tolerate. And within 2 weeks of treatment, that will be much better. Now, if the neuropathy is severe, and if it's diabetic neuropathy, it will take more than 2 weeks, but we'll also need your cooperation. We need to get your diabetes, for example, better under control. But, so it's not just lights. No one's silly enough to say, well, just do the lights and screw up the rest of your life. That's not what this is about. Smart eating, smart exercising, and all the other things like the spiritual aspect and all that. But smart eating, smart exercise, and red light therapy is a beautiful combination. So I want to talk to you about the healing aspect and why it works. But I just want to make sure you guys know, you go to the website, go to the Contact Us page. On the right side of that page is an option for you to maybe think about bringing this into your business. If you want to see your business flourish, if you want to see it grow like you can't believe, that bed becomes a centerpiece of your business. Now, it's not for accountants or bookkeepers. This is for people that know the body. It could be an esthetician. It could be, so we're talking about the whole fitness industry. We're talking about the health industry, the beauty industry. The weight loss industry is what we already talked about. And then even athletes. So if you're an athlete and you want to perform better using something all natural that has no side effects and couldn't affect you in any negative way, it's not like taking these injections and pills that people take. There are no side effects. You couldn't hurt yourself. You will perform much better if you use the bed prior to the activity. It's why we're at the NBA, the Olympic training centers, and several other really high-end athletic facilities, because they recognize that if you get in the bed before your activity, you'll do better. And if you get in the bed maybe the next day or sometime after, the sooner the better, to recover if you've injured yourself or whatever. So we have the world champion bare knuckle boxing champion, and he loves our bed, and he says a lot. So our name, our logo is actually on his trunks because he's so crazy about our Trifecta Light, and he uses that for a month before his bouts, and then he uses it again afterwards. And the thing that's unique about boxing, any other sport, you may be injured. In boxing, win or lose, you're going to be injured. And so it's wonderful for them, but also anybody that's an athlete would do very well to get in this bed before their bout or before their activity and after their activity.
So I have a question for you, Carl. Sorry to interrupt you. You're talking about putting the whole body in the bed and healing, and you shared about the brain and how that affects the brain, because MS is the brain, Parkinson's is the brain. You talked a little bit about moods, but what about those of us that have had like a knee or hip replacement? How does the red light affect that metal that's in the body? Is there any rejection that goes on? Because there's a lot of us humans that have
there's no side effects and no
joint
contraindications.
replacements.
There's no contraindication. So metal's not a problem. Electronics is not a problem. It's a light. It's a very healing, beautiful light, but it's a light.
Okay.
So, and I'm glad you asked about the brain, because when someone gets in our bed, we don't want them wearing the goggles. They just keep their eyes closed. We want that glorious energy getting into their eyes. And someone would say, well, what if I open my eyes? Is that dangerous? It's not dangerous. It's just annoying. The light is very bright, very bright. So you wouldn't take a flashlight, put it in front of you like that and just stare at it. It's annoying. It's not going to destroy anything, but it's not, and it can actually probably cause a little bit of a headache or something like that. Temporary, but a headache. So we just tell people, keep your eyes closed. The light can easily get through the eyelid. And you can think of anything in the eye that, including macular degeneration, macular edema, floaters in the eye, cataracts, uveitis, all those different things would be the light would be very helpful and effective for those issues. We also tell the people to keep their mouths open so that you can get in there with the gum disease, the tongue, the throat, tonsils, and things like that. Now, let's talk about the brain. It can get through the skull, get to the brain. And so I had a lady that wrote me a note after a few weeks of using the treatment. Prior to that, she was horrifically depressed. She didn't like her life, to be honest with you. She hadn't experienced this keyword called joy in many years of her life. Mm-hmm. And then she writes me an email down the road, and she says, if this is how normal people feel every day, I can't believe I've been missing out all this time. Because now she's experiencing joy like she hasn't done in many years. She doesn't remember the last time she experienced joy. So it helps with that. But getting back to knee replacement, hip replacement, shoulder replacement, it's a phenomenal, it works phenomenally with those things. But it begs the question, when I tell you that it will help accelerate healing tremendously, then I'm going to ask you the question, why do you suppose, if what I'm saying is true, and there are hundreds, if not thousands, of research articles, papers, double-blind studies, and all kinds of stuff to prove that this is true, why isn't it in every OR, like a wound center? So we had a lady that, more than one, but one I did a testimonial with, she had third-degree burns. She was guaranteed by the wound center 6 months of pain, 6 months of drugs, and permanent scarring. By the end of the second week, the pain was gone. By the end of the third week, it was gone using red light therapy. And again, by bathing the whole body at the same time, that's what makes the difference. So when somebody has a knee, an elbow problem, and we just focus on the elbow, as a holistic doctor, I would never do that anyhow.
Right.
But even using the laser on the elbow, yeah, you'll see some results. But wouldn't it be better to treat the whole body so you're handling the whole nervous system, getting the perfect nerve flow to the elbow, the circulation and everything. So full body is the way to go. I don't have an objection to people getting a mask or a helmet. That's fine. It's a toy. It's fine. But if you want the miracles that I'm describing, you need full body coverage.
Okay, so you're talking about full body coverage, and you mentioned 6 is kind of the 6 visits, 6 full body treatments initially.
To start, yeah.
To start, once you're healed from whatever it is that you're dealing with, how often after that do you need to lie in the bed? Once a month, once a week, once a...
So you know that I've answered this question thousands of times. So let me tell you why. As a chiropractor, and I've been a chiropractor for 40 something years.
Right.
I've probably seen 200,000 people, not different, I've had 200 or so office visits.
Right.
And it's common at the end, as we were nearing the end and getting that success with the person, they'll go, is this permanent?
Yeah.
And I always answer the same.
Because we all want it to be permanent.
So I'm a little bit of a wise guy from New York, and I say, yes, it's permanent. However, I have to stick you in the freezer, not let you get any older, not let you do the stupid things that you did in the first place to get you here.
Right.
So no, nothing's permanent.
Right.
You don't brush your teeth once a year or once in your life.
Right.
You do it preventatively so you don't wind up losing your teeth.
Right.
And you take care of your health preventatively so you don't lose your health. So it's we've had people that are so bad off in the beginning that we'll need to see them maybe once a day or twice a day.
Mm.
Now, a dose is 12 minutes. 13 minutes doesn't help any more than 12 minutes. But if somebody needs 2 doses, they just come back an hour or so later to get a second dose. But most people, it's 3 times a week. That's the most people come in for chronic conditions 3 times a week until we reach our target, whatever that is. And then we agree on the target at the first visit. What's our goal here? What do we want to do? Do we just want to get you out of pain? And I try to get people away from that notion because pain is a problem. Because
Right.
if you're using pain as a gauge of when you should have your teeth taken care of, if you go to the dentist, wait until you're in pain, by the time you get to the dentist with that, you're probably going to lose that tooth.
Right.
So
Right.
don't wait until you're in pain, but you can see other signs. There are other indications like lack of range of motion, like swelling.
Right.
Or if you have a really great health practitioner, most people waited until they were in really bad shape before they go to see any doctor, especially men. They're terrible about this. But I would spend a lot of time, repetitively, trying to emphasize that my goal is to get them to come in after we've handled this on a maintenance program. Usually at that point it'd be once a month. And what I want them to come in and say, listen, doc, I feel great. And I want you to help me stay that way. Or I am great. Now with red light, I'm 73 years old. I'm going to use that bed 3 times a week for the rest of my life. And I don't have a particular ailment or issue. And I'd like to not get them. I know that's impossible. But what I always teach my patient, it's like a candle that burns really bright from the beginning all the way down to the bottom and then sputters out and dies. That's how we should all go. But in this country, well, maybe all over the world, the last 10 or 20 years of most people's lives ain't so great. Many people are invalids. They're living in a home where they need somebody to help them feed themselves, wash themselves, and even wipe themselves. And I don't want that.
Right.
So I'm trying to avoid that as much. I don't want to jinx anything here. But I'm trying to avoid that as much as I can.
Yeah.
So I eat smart, exercise smart. I do other things. The things that I stay away from, I'll tell you why many people don't take care of themselves. Because they're not scared enough. They don't realize what they're doing to themselves when they're younger is going to have an effect. So I'll have a patient come in, I can drink a 6-pack every night, has no effect on me. Well, you're 30 years old. Talk to me when you're 60 and tell me what that's like.
Right. Right.
So what I want you to listen carefully, each of you, is your older self crying in the background, going, please take better care of yourself. Because
Yeah.
how did I get scared? I'd have patients come in. Remember, I told you hundreds of thousands over the lifetime. And I would see some of them, and I wouldn't say it out loud, but to myself, I would think, please, God, don't let me wind up like that. And that scared the heck out of me. I don't think I came from the most disciplined family in the world, but I did get scared to bits from from that, and I don't want to wind up like that. So I do other things about, things to avoid, and and I'm not letting anyone inject or take pills.
Right.
I don't take anything. No
So
injections,
yeah.
no pills,
Right.
nada.
So basically, the message is take care of the body, take care of the heart, take care of the brain, take care of the emotions, do inner work, and include red light therapy of whatever genre the person, chooses to do as part of their exercise and physical health and maintenance, is sort of what you're saying. We have about 2 minutes left in the show. Is there any key point that you just need to make? And we'll share your information across the bottom.
When you're given 3 wishes by the genie, one of those wishes would be, can I have more wishes?
Yeah,
You're
right.
giving me 2 minutes. I need a couple more, because I wanted to tell everybody how it worked so
Go
that I
ahead.
don't sound like I'm nuts.
Okay.
I think I can do it in 3 minutes. So I
Okay.
just want you to know
You
how
got
it
it.
works. We talked about red light therapy and only red light therapy, fat loss. Now we're going to talk about everything else. And this is the near infrared. So the word infrared, there's no such thing as just infrared. It's either far infrared, which is heat, which is what we want to avoid, and I'll tell you why in a minute. And the near infrared is considered cold. And that's the glorious, it's not literally cold, but it doesn't get hot. In fact, if you're using lights that get hot, that's the cheap knockoff you're getting from Amazon and China and all that stuff. You want the highest medical grade lights you can possibly get that are very strong without getting hot. So how does it work? It's a little bit of red, mostly the near infrared, that is the healing element. And you can look it up if you go to Google Scholar, which I'll send you show notes. So I only have 3 minutes, so don't ask me that question.
I'm not going to ask you any questions.
Go to Google Scholar and put in the phrase, put in the word photobiomodulation, which I'll send you the show notes to that, and then put next to it anything that you want to know about, including how near infrared can help you. It's NIR is the way it's abbreviated. So what they learned was that it's basically elements of sunlight. And we've taken 4 glorious elements of sunlight, both red and near infrared, magnify it many times and drive it into the person's body. Remember, no side effects. So people say, what about this or that? It's not, we don't have UV light in here. We don't have blue or any of the other colors that can screw up the circadian rhythm or anything like that. It's just red, but primarily near infrared for the healing. And the key word here is the mitochondria. Now, the mitochondria, that some of you remember in biology, is the powerhouse of the body. And that powerhouse of the body is a little organelle in every cell of your body.
Right.
And it was believed when I went to school that there was one mitochondria in every cell, and that turned out to be way off, because,
Right.
for example, the heart, which has the highest demand for energy, has over 5,000 mitochondria in each heart cell. And so what they've learned also, to give you an idea how prevalent, how important the mitochondria is as the powerhouse of the body, is that there's so much mitochondria in your body, it makes up 10% of your body weight.
Mm-hmm.
Nobody believed that. And look it up when you can. You'll see 10% of your body weight. So I'm almost done. So what they found was that these elements of light, the red and near infrared, can stimulate the mitochondria to come back to health. Now, mitochondria produces this energy currency we call ATP. And it's the reason why you breathe oxygen and eat food. And by eating and breathing, and the mitochondria produces this ATP, which, if you have the right amount of ATP, you will function and be fine. And if you don't have enough ATP, it'll eventually lead to disease and death. And so this light energy brings you back to health. And that's why it sounds like snake oil, where every cell and every tissue in your body can be affected. And I apologize, because that's what it does. It affects potentially every cell in your body. And by affecting those, that's where the miracle results come from. So try 6 visits and give me the feedback when you're done with those 6 visits. But first, find out if we have an office closest to you, and we'll do that. So I just did the quickest review on mitochondria ever known to mankind.
Well, one of the things that people can do is look up mitochondria, because mitochondria are just really wonderful powerhouses in the body. And check out Carl's book, Illuminated Healing. You can get it on Amazon. And, thank you so much. I could feel, and I'm sure the audience could feel too, your passion and your excitement, and how you really want to share this information, this healing process that we can all participate in if and when we choose with the world.
I appreciate the opportunity. Remember, the website is trifectalight.com. And as far as the book's concerned, I do not make a penny off of that. It's any profit goes to charity, but it's a decent read. And if you want to know about red light therapy and pronounce yourself as an authority of it, read that book. It's on Amazon.
Yes, it is. I've found it, actually. So thank you so much for your time. We really appreciate your energy, your passion, your concern for the healing of all people in whatever way they need to heal on all levels. So thank you so much. Thank you, everybody, for being here. Let's take another couple of heart breaths, and blessings to each one of you as you walk through the rest of your day. Brenda signing off. Bye for now. Thank you, Carl.